Good evening, and thank you all for being here. And more importantly, I want to just thank the presence of our leadership across our region. And Madam President, it's good to be not only with you, but each and every one of my brothers and sisters. It's just an honor. And thank you so much, President Guy McGinnis, who I got that text message early this morning, wanting to organize. I said, let's do it. And everyone else said the same, which is why we are here this evening. Regional collaboration is a top priority, and that's what we're demonstrating right now. As mentioned, Governor John Bel Edwards, of course, did a statewide stay-at-home order. This is in line with the steps that we took in the city of New Orleans on Friday. And the message we're here to make very clear to the public: stay home. Testing has ramped up, and as we have been saying, once tests have ramped up, which they are, we will see the results, and we will also see the impact growing significantly. This is what we have been expecting, and it's a good thing because we, one, have to understand where we are in terms of the bell to even understand how we can flatten that curve. Right now, we don't know where the curve is, which means that we're pleading to our public, to our residents, to stay at home. We opened up 2 drive-through testing sites in Orleans Parish. We're here right now in Jefferson Parish, where they opened up on yesterday. We have just seen the response from our community. It's been phenomenal. Today, we were able to open it up to residents throughout the city of New Orleans for testing, as well as we stood up, of course, testing sites that are available to those who can walk in throughout the parish, over 31 of them. Today, we open testing again to individuals 18 years or older who have symptoms. Today, we completed our daily max at 250 per test site. So a total of 500 tests were completed by 3 p.m. The drive-through testing sites will open up tomorrow at 8 a.m. and will be open until 6 p.m. or until we have maximized our reach. We are constant in terms of contact with our federal delegation and advocating for our needs. Over $250 billion in flexible emergency fiscal assistance to be allocated directly to cities who are in need, and we collectively are those cities in need. This will empower the nation's mayors and our parish presidents to immediately take the bold actions necessary to protect our people, our public, from both the pandemic as well as the subsequent economic fallout. This also speaks to the needs of our healthcare professionals who are on the front lines daily, and I cannot overstate enough how they have been unwavering in their efforts every single day, 24 hours, meeting the demands of our public. But they need more support. And so the president to declare COVID-19 a major disaster, to unlock several FEMA programs like individual assistance programs, is something that we need. We also understand that our partner, the Second Harvest Food Bank, they're running out of food, and we need them to be able to access the USDA, the federal assistance programs for feeding immediately. We need to reduce the city's cost share for FEMA as it relates to public assistance programs. These are things that we need immediately, and we're asking and we're advocating on behalf of all of our residents as it relates to advocating to our federal delegation and, of course, the President of the United States. We need people to listen, all of our people to listen to our safety leaders, to our healthcare professionals, to stay at home, practice social distancing, essential services only, food, pharmacies, banks. Your healthcare providers are at work to protect you, and let's do all that we can to ensure that they can protect us. But they cannot protect us from ourselves if we're not following the rules. So we are all in this together, and right now, the way that we can come together for our people is for us to collectively stay at home.